Brain herniation syndromes. Brain herniation syndromes are a group of neurological disorders that occur when the brain tissue is displaced from its normal position due to increased pressure within the skull, leading to compression of vital structures within the brain, resulting in severe neurological deficits and even death. Brain herniation syndromes are a medical emergency that requires prompt diagnosis and treatment to prevent irreversible brain damage. Types of brain herniation syndrome are subfalcine herniation, which occurs when a part of the brain, usually the cingulate gyrus, is displaced under the falx cerebri, which is a fold of the dura mater that separates the two cerebral hemispheres. Transtentorial herniation, which occurs when a part of the brain, usually the temporal lobe, is displaced through the tentorial notch, which is a narrow opening in the tentorium cerebelli, a fold of dura mater that separates the cerebrum from the cerebellum. And the tonsillar herniation, which occurs when the cerebellar tonsils located at the base of the brain are displaced through the foramen magnum, which is the opening at the base of the skull. Brain herniation syndromes are usually caused by increased intracranial pressure, which can be due to various factors, such as traumatic brain injury caused by bleeding or swelling within the brain tumors causing compression of surrounding structures, and increased pressure, cerebral edema, an accumulation of fluid within the brain, or hydrocephalus, which is an abnormal accumulation of cerebrospinal fluid within the brain. Common symptoms of brain herniation syndromes include severe and persistent headache, nausea and vomiting, altered consciousness ranging from confusion to coma, seizures, abnormal breathing, and dilated pupils. The diagnosis of brain herniation syndromes is based on clinical examination and imaging studies such as computed tomography, scan, magnetic resonance imaging, MRI, and intracranial pressure monitoring. The treatment of brain herniation syndromes depends on the underlying cause and severity of the herniation. However, some common treatments include medications, such as diuretics to reduce cerebral edema, anticonvulsants to control seizures, pain medications, and surgery to remove the tumor or the hematoma or decompress the brain tissue. Close monitoring of vital signs and appropriate support might be needed.